Good day to our nursing fundamental students on this second week of remote distance learning, 11th week of the semester. This week we will be discussing the process for assessment of the integument system and wounds. Okay, students, as we begin our discussion of skin integrity and wounds, because this is going to be a virtual remote lecture, I'm going to place these in 3 parts because it'll be too large of a file for you to open. So this is part 1 of the skin integrity and wounds. First of all, we'll have a little review of the anatomy and physiology, but not a great review because you should already know about the structures of the skin and the integument. We have the epidermal layer is the outermost layer of the integument, and then we have the dermis and the subcutaneous layer. And subcutaneous and areolar connective tissue are really combined together. But what is interesting is not only is the epidermis, or the skin, is the largest organ of the body, it also plays an important role as the first line of defense. And within that line of defense, within the stratum germinativum, the innermost layer of the epidermis, lies several functional cells. They're keratinocytes, are cells that produce keratin. It's a pigment and also a tissue for tensile strength is keratinocytes, and it's a hardening agent. Okay, is the keratinocyte, and then the melanocytes are really secrete a skin toning oil that gives the skin pigmentation of peoples around the world. Are often related to the type of melanocyte and the production of the type of oils that are released, or secretions released from the melanocytes. And then there's the Langerhans cells. The Langerhans are, in fact, part of a frontline layer of our immune defense system, our Langerhans cells, embedded within the epidermis. The dermal layer is oftentimes where we do a intradermal injection, and of course the subcu layer is also a layer where we administer medications within the skin or under the skin, particularly insulin. Factors that can impact the skin integrity. First of all, we have the aging adults. As we all age and have exposure to the elements, we have less elastic, we have less collagen, and we have a hyperpigmentation of the skin. And it's more prone to injury because of the decrease of both the elastin protein and collagen proteins as we age. So we are more prone to injury to the skin. Our mobility status really impacts the skin as well, as a patients or as persons have an increased risk for developing pressure, shearing, tears, and friction tears can lead down to skin breakdown because of changes in mobility. And also with the changes with elastin, which is the stretch fiber in the skin, in the epidermis, and we have collagen, decreased collagen secretion, which is the strength given to the skin. So both of those leave the skin more brittle and less elastic, causing it to stretch and tear or shear when it's pulled upon. And then immobility itself it's a major risk factor for decreasing the integrity of the skin due to paralysis, extreme fatigue, high-risk pregnancies where a mother might be bedbound to trying to preserve the pregnancy. Sedation, medical sedation, prolonged sedation, or in states in hospital settings. Casts, which are used to immobilize and can cause decreased general mobility when a lower extremity. How about traction? You're certainly going to be placed in immobile states when your lower extremity is placed in traction. And then we have the altered sensory and perception related to sometimes, most oftentimes, to maybe spinal injury can be a cause for that, or musculoskeletal diseases and or paralytic diseases that can cause that altered sensation to the skin, which can, in fact, put it at risk for breakdown. Matter of fact, the altered sensory perception is the #1 factor for patients at risk for skin breakdown, because they don't have a sense of the pressure or the fact that they've stepped on something, and then they have a major ulcer that occurs. But nutrition and hydration also affect, particularly protein. Proteins are a huge part of our body's ability to self-maintain itself and for self-repair when there's trauma or damage to tissues or organs. Proteins are critical for the maintenance of our skin and the integrity of our skin. And also some vitamins play an important role. Vitamin C, zinc, copper, as well as vitamin E, which is not noted on this, but also has an impact on the integrity of the skin. And in certain areas where people live, they may have decreased access to good nutritional diets, so they has to be focused to maintain really good skin. And then we already talked about the neural sensation levels, diminished sensation, which is the #1 reason or risk factor for patients at risk for altered skin integrity and increased risk for their skin to be broken down, and especially or injury or trauma, because of the fact that they have loss of senses to not only touch pressure, but also heat and cold. So a bath for you and I, we can sense if it's really hot, but for them, they may have a scalding burn because they may not have the nerve function to distinguish that. So it's important for them to have prevention of that by setting a water heater to a lower temperature to prevent scalding burns with people that have decreased neural sensation, particularly for heat and cold sensations. So how about impaired circulation because of disease process or decreased cardiac output? With impaired circulation affects tissue metabolism, and that includes the exchange of nutrients and oxygen across the capillaries into the tissue space, and that creates a risk, and particularly venous circulation, venous stasis ulcers. And you learn that in health assessment, the difference between venous stasis versus arterial ulcers. And that's an important thing to consider. But these all are related to impaired circulation. Venous stasis and arterial insufficiency can produce ulcerations, and they are unique. So you need to pay attention to those types of findings in those two types of impaired circulation. So, but medications can also impact the skin, not only with the front line. Sometimes the first line reaction we have to a medication might be to have a skin rash or a sore and having itching and rashing occur, which are good, often first signs of a allergy to a med, which is good. But photosensitivity can be also a big factor with many medications that can cause severe burns to the skin if people aren't protected appropriately when they're exposed to long exposure to the sun. And that can also, medications can impair or delay wound healing, such as the antineoplastics, and how about the anti-inflammatories? They all can cause delayed or prolonged healing of all tissues. Also, there's infections. We know there's skin infections that make it vulnerable to breakdown. It could be because of cut or how about for those of us that like pets? I don't. But those that have cats or dogs and get a cat scratch on them, and that scratch can end up being a source of infection in the skin and can lead to actually a tissue infection of the skin, and that's called cellulitis. seen that happen multiple times, and but those are can cause significant changes in the skin, and it can impede wound healing or skin healing too. Infections, a wound will not heal, or a lesion, a sore will not heal unless the infection is cleared. With the infection in place, the wound or the skin will not heal. So that compromises that. And then we have also our lifestyle factors, especially when we're prone to live in areas where we have great times of sunshine and beach and sands and bathing pools. That excessive exposure to tanning in the sun, or bathing products that might be used, or bathing frequency and the type of water can also affect the skin and the skin piercings. Those elective choices to get body piercings or tattoos are risk of infection. And the places where people are putting those piercings, it can create a huge complication, particularly tattoos. And in some of the areas where they're getting those, tattoos or body piercings can lead to at least about 20% of local infections, which can be exacerbated to move into sepsis or cause endocarditis because of lack of treatment, and it may result in hepatitis as well as toxic shock. And if toxic shock syndrome comes in, then they have a next stage of that is trickle down of vascular insufficiency. So we're going to end with part one with this thinker question. Of all the following factors, which would put a client at greatest risk for impaired skin integrity? We've talked about this multiple times, and if you select answer C, you are correct. That the fact that neural sensation changes is the greatest risk factor for skin breakdown, because if you can't feel, you don't know what you step on, or you don't know how hot the water is to get a scalding burn. So that can be that's a big issue. So this will end our part one of this series of the skin and wounds.